moving towards another part of this topic. Let's start it. Bismillahirrahmanirrahim. So basically now we learn about the therapeutic platelet transfusion. Means the platelet transfusion required in many diseases. So one of it is actually thrombocytopenia, when there is actually active bleeding and the platelet counts is less than 50,000 cells per cube millimeter. So 1 unit of platelet, which is actually 60 ml, basically for every 10 kg of body weight is required. Platelets is actually transfused within the 4 hours actually in the start of the infusion. ABO compatibility is is not important for the platelets. Actually, the filters which are used is 150 to 260 micro must be used in order when you are transfusing blood, as other blood components does not transfuse with it. Very important. Okay. Also, fresh frozen plasma, basically it is the remaining plasma, which is actually 200 to 350 ml, that is stored in a frozen form, which is actually at a less minus 18 degree for almost 1 year. It is also known as fresh frozen plasma. It is basically it is need to be thieved over half an hour before use, means to convert the solid to liquid form. Okay, fresh frozen plasma transfusion is indicated in patient with prolonged INR, means their clotting time is more. So and there is actually risk of bleeding. So means INR more than 1.5. INR is basically tells you in how much time the platelet is formed. And bleeding on surgery, means when the patient require when there is a bleeding during or required during surgery. Okay, it provides coagulating factors to those patients who have actively bleeding and those on morphine, because there is also high risk of bleeding in this patient. Okay, so basically 10 to 50 ml per kg body weight. This is actually ABO compatible, which is very important point. Okay, it should be transfused as possible after thawing, or definitely within 24 hours of thawing. A hanging unit must be transfused within the 6 hours of start of transfusion due to the risk of the bacterial contamination. Karyoprecipitate, which is also very important. It is actually a fresh frozen plasma that is further treated, and they produce a karyoprecipitate that is rich in fibrinogen. Each bag contains 20 ml, that is indicated in patient who has fibrinogen levels less than 1 kg, for example, disseminated intravascular coagulation. In them, you needed this. So basically, what is the disseminated intravascular coagulation? It is basically a serious and a life-threatening condition. Okay, where the body's clotting system becomes abnormally activated and there is a widespread clot formation in a small blood vessels, and then there is followed by excessive bleeding. In those patients, you require this. The dose is actually 0.2 units per kg body weight, but usually 10 units are transfused initially in order and repeated as necessary. Important points required during transfusion. Before transfusion, you should take consent from the family image and from the patient also, and the close relatives. In emergency situation, recheck the blood for any mismatching. Okay, the blood group and the donor blood group. Okay, and ensure that the correct bag should be transfused to the patient. The patient's hospital number and bag number should be checked, and both people must sign on the transfusion report. Okay, check the blood bag for any abnormality such as dark blood or clotting in case, or do not transfuse the blood. Okay, return to the bank. Check the date of collection and date of expiry before transfusion. Okay, check the storage life of the RBCs, that depends on their preservatives. You have different type of preservatives like acetate dextrose, then you have citrate phosphate dextrose, then you have citrate phosphate dextrose adenine, you have saline adenine glucose mannitol. These they have the shelf life of 21, 28 and 35, and then 35 also days, but the most common you use actually citrate phosphate dextrose adenine. and watch for any reaction. Whole blood is transfused, not commonly recommended just in case of massive trauma. All the components are transfused simultaneously, but for matching the loss. Okay, now basically this blood should be screened for any infections and for antigens. Okay, other products are also available like fibrinogen concentrate, high risk of hepatitis, factor 9, factor 8, also in hemophilic patients, Christmas disease respectively, factor the 7, which is actually deficient in a disseminated intravascular coagulation patient.